10 signs of adult ADHD. Individuals with inattentive ADHD are more likely to experience the following symptoms. 1. Trouble focusing or paying attention. People with ADHD may lack control over what they focus on and have difficulty concentrating. You may notice the following: easily distracted, daydreaming, zoning out during conversations, overlooking instructions and details, unable to finish projects or tasks on time. Another symptom of ADHD is a tendency to hyper-focus on projects you find exciting and interesting. In this state, you may be unable to turn your attention toward other important tasks or people in your life. 2. Losing things frequently. Storing, organizing, or keeping track of belongings can be troublesome for those with ADHD. This can involve misplacing everyday items like car keys or wallet while the brain is on autopilot, losing track of where an item is placed after a moment of inattention, constantly retracing steps to find lost items, storing things in the wrong places like work papers in your car, dirty dishes in the bedroom. 3. Chronic lateness and poor time management. Due to poor time management, adults with ADHD often run late for meetings, appointments, or social plans. Reasons include unable to find required items such as car keys, wallet, meeting notes, etc. Forgetting dates and times. Underestimating the time needed to complete tasks, also known as ADHD time blindness. Getting distracted while preparing for an appointment or event. 4. Impulsivity and risk-taking. Research shows that adults with ADHD are more likely to engage in risk-taking behavior, RTB. These behaviors may involve the following: starting arguments or fights, overspending, reckless driving, substance use like alcohol or drug, risky sex-related decisions like unprotected sex, gambling, impulsive eating. By seeking help and support, you can proactively reduce your chances of involvement in these activities. 5. Difficulty listening and following instructions. Social interactions may feel like a challenge if you have ADHD. You may struggle with waiting for your turn to speak, staying on topic, keeping track of the conversation, using nonverbal cues to show active listening, talking too fast, speaking too much, blurting out words that make others uncomfortable, unable to read other people's body language. 6. Struggles with prioritizing tasks. Adults with ADHD are almost always occupied. However, deciding which task to prioritize can be a challenge. You may struggle with prioritization for any of the following reasons: feeling like you have too much to do, which can overwhelm you, even get you into a state of ADHD paralysis. All tasks feel equally important. Difficulty thinking ahead. You underestimate deadlines. Seeking novelty over familiar tasks that may be more significant and relevant. Adults with ADHD also tend to procrastinate on tasks that require more focus and attention, leading to missed deadlines and workplace issues. 7. Relationship struggles and communication issues. Problems in relationships with friends, colleagues, family, or partners are another common issue for adults with ADHD. There are several reasons why symptoms of ADHD can cause tension, anger, and frustration. Some ADHD traits that may lead to relationship strains include speaking over the other person, not actively listening to the other person, forgetting important events and dates, like birthdays, blurting out hurtful statements, failing to fulfill responsibilities, commitments, or promises, trouble regulating emotions. Despite these challenges, adults with ADHD can have happy relationships and fulfilling marriages. Seeking professional counseling and support is one of the best ways to work toward this. 8. Hyperactivity or restlessness. Another sign of ADHD in adults is restlessness. This may present in a variety of ways: flight of thoughts, constant fidgeting, tics and impulsive behaviors, overthinking and catastrophizing, trouble sitting still. Fidgeting is often misinterpreted as inattention in adults with ADHD. However, fidgeting and stimming can signify attempts to stay focused when a task doesn't provide enough stimulation for the brain. Interestingly, fidgeting may help increase the ability to focus and concentrate in adults with ADHD. 9. Forgetfulness and working memory. Issues. ADHD may impact two different kinds of memory. Working memory is your brain's short-term storage space, and it's where adults with ADHD are more likely to experience problems. Here are some examples of how ADHD can impact working memory. Forgetting things on grocery lists. Leaving essential items at home. Losing track of belongings. Difficulty following instructions to complete tasks. Rereading sections of text due to not retaining information. ADHD's impact on long-term memory isn't well understood. Some research shows that adults with ADHD may experience problems with long-term memory. That's because the ADHD brain may encode information in a disorganized way, interfering with the storage of new information. 10. Emotional outbursts and irritability. Around 30 to 70% of adults with ADHD experience mood swings and emotional dysregulation. Adults with ADHD may notice the following signs of emotional turbulence: impatience when under stress, explosive outbursts of anger, persistent irritability, surges of anger when met with everyday obstacles, frequent and reactive mood changes, unaware of the other party's feelings. Professional therapy, medications, and self-care can play a vital role in managing ADHD-related anger. How to know if you have adult ADHD. If you're experiencing symptoms like lack of focus, restlessness, or poor memory, you may be concerned that you have ADHD. You can take an adult ADHD screening test, which can give you a better idea of what your symptoms indicate. Of course, the best way to determine whether you have the condition is by getting assessed by a healthcare professional. ADHD can look quite different in adults compared to children. So, try to pick a doctor or specialist who has experience diagnosing and supporting adults with ADHD. To get a diagnosis, you need to have a few symptoms of the condition, not just one. Your doctor will also ask how these symptoms have affected your daily activities and how long you've been experiencing them. Additionally, they may ask to talk to someone who knew you well as a child, like your parent or guardian, to find out if you showed signs of ADHD in your childhood. Adult ADHD symptoms. It's not too late to get them diagnosed. Many adults live for years without realizing they have ADHD. Instead, they blame themselves, thinking their struggles are due to personality flaws, laziness, or bad habits. That's why getting a diagnosis can be life-changing. It brings clarity, eases the guilt, and opens the door to the right treatment, tools, and support. With this, many adults with ADHD go on to lead more confident and empowered lives. This is why it may be worth evaluating your symptoms if you've struggled with focus, memory, or restlessness, but never understood why. The process usually involves talking to a healthcare provider about your experiences and how your symptoms affect different parts of your life. Remember that it's never too late to seek help, even as an adult. This step often marks the beginning of a new chapter where you can finally get the support and resources you need to thrive and achieve your goals. Types of ADHD. The symptoms of ADHD can look different from person to person, depending on the type of ADHD they have or their subtype. Hyperactive, impulsive type ADHD. Someone with hyperactive or impulsive type ADHD is more likely to struggle with symptoms linked to restlessness and poorer impulse control. This is the second most common type of ADHD in adults. It comes in second after inattentive ADHD because symptoms of inattention are more likely to persist into adulthood compared to symptoms of hyperactivity or impulsivity. Individuals with this form of ADHD may notice the following: constantly leaving their seat when expected to stay seated, blurting out answers before the question is completed, fidgeting and moving about when seated, cutting into other people's conversations, having trouble waiting their turn in line, taking over other people's activities, often feeling restless, interrupting others, talking excessively, always on the go. A diagnosis for this type of ADHD may be made if you have 6 or more of the above symptoms for at least 6 months. Types of ADHD. The symptoms of ADHD can look different from person to person, depending on the type of ADHD they have or their subtype. Inattentive type ADHD. Adults with inattentive type ADHD have more difficulty with their focus, attention, and memory. This is the most common subtype in adults. These individuals are more likely to notice the following: having trouble organizing their documents or belongings, losing focus quickly when working on boring tasks, having many distracting and unrelated thoughts, avoiding tasks that require them to stay focused, getting distracted in conversations, struggling with time management, forgetting to do an errand or task, overlooking important details, making careless mistakes, misplacing important items. You may be diagnosed with inattentive type ADHD if you experience 6 or more of the above symptoms for 6 months or longer. Types of ADHD. The symptoms of ADHD can look different from person to person, depending on the type of ADHD they have or their subtype. In general, there are 3 main subtypes of ADHD. 1. Predominantly inattentive ADHD. 2. Predominantly hyperactive or impulsive ADHD. 3. Combined type ADHD. Let's explore each subtype in more detail. This video is about combined type ADHD. A person who persistently struggles with both symptoms of inattention and symptoms of hyperactivity or impulsivity has combined type ADHD. This is the least common kind of ADHD in adults. You may be diagnosed with combined type ADHD if you have 6 or more symptoms of inattentive ADHD and 6 or more symptoms of hyperactive impulsive type ADHD. ADHD can look very different from one person to another, even if they have the same subtype of ADHD. This is why it's important to personalize your treatment, therapy, and coping strategies based on your symptoms.